Hi, my name is Medina Thompson. I'm Senior Information and Content Officer at Bliss, the charity for neonatal and sick babies. And today I'm talking with Dawn and Jamie about family integrated care and how it impacted their neonatal journey. Family integrated care is a model of care for babies born premature or sick, which promotes a culture of partnership and collaboration between parents and healthcare professionals who are working to care for babies on the neonatal unit. So, I guess my first question is for you guys to introduce yourselves and tell me a little bit about your neonatal journey. And then I'll ask you if you knew what FICare was and how you knew what it was, basically.
Yeah. So I'm Dawn,
I'm Jamie.
and we had a little boy who was born at 28 weeks, and we spent 12 weeks,
12.
12 weeks,
30.
almost 13 weeks across 3 different hospitals with him until he was well enough to come home. He was our first baby.
On last.
Yeah.
And what's his name? If you don't
Clay.
mind sharing. Claire.
Clay.
Lovely. So did you know what FICare was before you had your neonatal journey or during your neonatal experience?
I did. I was aware of it. I worked as a nurse, so in paediatrics, so it was something that was familiar terminology to me. However, I don't think
I didn't know, and probably still didn't know until Don had said about this, doing this video. I knew aspects of it from being in the hospital and different hospitals, especially the first hospital we were in. They were really good at kind of telling us what we're entitled to and things that they advocate and things like that through the FICare. But no, I don't think it was ever kind of spread as being FICare through any
I
of
don't
these
think the
hospitals.
words of it between any of the hospitals, the words family integrated care ever came up. But I do think, especially now that you know that there's a name to it,
Mhm.
on reflection, it was very clear to see when it was being carried out.
Yeah.
Throughout our stay.
And then I can imagine it's also very clear when it wasn't.
Yeah.
Yeah, very clear when it wasn't as well.
Yeah, that makes sense. So for you as a family, what barriers, now that you do know, Jamie, what family integrated care was, and Dawn, you're saying that you knew already, but now looking back, do you think there were any barriers for you being involved in your baby's care, being partners in that care?
A big one for me was probably the being a part of the ward round. So, second hospital was it? Unfortunately, first hospital there was a virtual ward round that you could log on to, and you could kind of find out what's happening in the baby care stuff like that. But other ones we went to wasn't. So I feel like that was a kind of big barrier, and not being able to be a part in that, which kind of
Because you were back.
kind of leads on to my next point, which another big barrier was being back at work. So obviously, Dawn was off from maternity, so she had time to be in hospital with Clay. She was basically 24/7. But for me, I had to go back to work. There was no neonatal care, which probably
Okay, yeah, I
Fine.
get that.
that wasn't a thing at the time.
It's nice.
Yeah, that's really difficult. How did you feel having to go back to work, Jamie? Was it really tough?
Probably getting ads, but I see it as a way to get out. I'm a doer. I don't like sitting about and vegetating almost. So for me, it was kind of a good outlet to get back to work and do something. It's hard being disconnected from Clay and Dawn, but at the same time, it was good for my kind of mental sanity being back at work. But yeah, I think the probably hardest part was being back at work, but you not wanting to come home. So the mornings were early and the nights were late, sort of thing. So it was just never ending. And then especially when you ended up staying in there, there was probably about 4 or 5
Yeah,
weeks
we didn't see each other.
we didn't see
Really out west, just within a hospital setting.
Right. So Dawn was staying in the hospital, and I've struggled to being in hospitals and stuff like that. So I just don't like it. So obviously Dawn's used to it. So she was staying in the hospital and I was coming home. I've got a wee cat as well. So I was kind of coming home looking after her, make sure it was all right, doing the washing, kind of doing normal life really. So like I said, I was up early in the morning into work, coming home straight to the hospital, spending time till late at night and then straight home to bed really.
I think as well, maybe would have been easier as much as your work was flexible to an extent, is like having that like commitment of he had to be there at his work. So then if things were really bad and if it was a really tough day in the hospital, I was like, I can't just phone him because he's in a meeting.
Mhm.
So it made it difficult that if there was big decisions or big changes going on in his care, that like as much as you could answer the phone, you weren't able to give it 100% of your thought and 100% of your kind of space because you were awful in the middle of something else.
Mhm.
So it's like you don't want to phone you and be like, so they're thinking about doing this, and you're trying to think about that whilst you've also then got like a million work calls going through. So it was a lot to balance, I think.
Yeah. Mhm.
Yeah,
Kind of switching
that makes sense.
my brains from work brain to, because even like in normal day to day, if I've done phones for work stuff, I'm just like, yeah, just whatever, just do whatever, make a call. So it's quite hard switching between the two. I definitely say the weekends I was more, because I don't work weekends, it's only Monday to Friday, so I was kind of more present, and I would say I was more involved with the decision making and actually had a say. But during the week, I was too focused to work that I couldn't really digest what was being said.
And they also don't make a lot of decisions on the weekends.
No.
So you don't get the same, a lot of the decisions are made through the week when you're at work. And then the weekend is kind of like, oh, well, we'll wait until Monday. And that was quite hard. I think for me, in terms of barriers, what was really difficult was the traveling, because we originally had Clay in like out with our locality. We were in like a different health board, and I'd had a C-section. So I was relying on Jamie or someone else driving me to the hospital because they didn't have enough rooms. I thought that was it was a like leaving your baby, and then also like even when there was rooms, you weren't always necessarily what they would say is entitled to those rooms because other people were more entitled, and it became quite difficult to sometimes like the example I can think of in my head was when he got his immunisations. I I wasn't breastfeeding it. Well, I was expressing, but he wasn't going to the breast yet. So in theory, I wasn't required to be there for him to be able to get his milk. So when he got his immunisations, I knew that he wouldn't be great and he would maybe be having a rough day or a rough night and he might just feel a bit rubbish. But because he wasn't going to the boob, when I was like, I really want to stay tonight and I want to be with him, because in any other circumstance, you would be at home being able to give your baby a cuddle if you needed it. It was like, well, you can't because we've got someone else who they've got that room and they're more entitled to it. And the only reason I was able to stay, even then I said, well, I'll just bring a pillow and I'll stay here all night. I know it's a 24-hour policy and I know that I can stay here. You can't chuck me out. It was open visiting for us. That was, I knew I could, but that was kind of frowned upon or looked as we wouldn't recommend that you sleep on a chair because you should go home and get some rest. But equally, I wasn't going to be getting any rest at home because I would have been worried sick. And the only reason I was able to stay was because I was actually friends with one of the mums that did have a room, who had another child at home, who said, look, it's fine. I've got a child at home and actually it would do me good for me to go and spend a night with him. So you can take my room. And it was through the parents and the support of the other parents that I'd met that I was able to then spend that night with them, rather than through the nurses advocating for it. It was quite difficult.
Mm.
And the only other thing I'd say is like the visiting hours were different in all the hospitals that we went to, which I think are wider, like the family finds a bit more difficult to then for them to feel involved and for them to be a part of it. We had open visiting at the first two hospitals, but the final hospital we were at only had an hour of, and I think it was one in the afternoon and then one at night, but even at that it was like 2 p.m. and maybe 5. So then it was, if someone worked, it was none.
Mm.
And you got 2 nominated visitors and they could come in whenever they wanted. But again, then you're trying to pick between 2 sets of grandparents, or actually the visitors are there for me because it's needing more support. So I had one of my friends that actually worked in the hospital so that she was easier to access and she was closer. But it was a big change to being able to say, well, actually, you are now all tied into this. If you want to come, it has to be in those hours. And those hours didn't always suit when maybe I was expressing, or when I wanted a visitor, or when that would have been beneficial to us as a family. And we found it quite hard, like going from one, and I know that the grandparents as well found that difficult changing to being able to say, oh, well, we'll nip in at this time. And actually, if that didn't suit, they would sit in the canteen and wait until it did suit for them to come up. But they were restricted to, no, it has to be at this time. And if it's not, then they can't come, and then they would miss out. And that was thing wasn't great.
Yeah.
That was something that was difficult in between the moves.
Yeah, I mean, the family. It also sounds like you're a lot of workarounds. So not necessarily policies or support from the healthcare professionals, but things that you're having to do to kind of, okay, so I'm friends with someone who has a room and they're going to allow me to stay, or I'm friends with someone who works in the hospital, so they're going to be able to visit me. Lots of things that weren't necessarily being facilitated for you in the way that you needed.
Mm-hmm.
Whereas it would have been great to just be like, I'm really struggling at the thought of leaving him after his drags. Please, can I stay in, for them to be like, yeah. And I get in a sense that goes into, it would be great if all the neonatal units had more rooms for families. I think that would be huge, because even in one of the second hospital we were at, we again were still out of area, and they didn't have any rooms available on the unit. And at the time, they had like a Ronald McDonald House type for people that were out of area. But we came at a time where that was closed, so we got put up in a local hotel, and that was fine. But again, I couldn't drive through the night, so like I was tied into, Jamie must drop me off at 6 a.m. and Jamie must pick me up. And now looking back on it, actually, I know from my working experience that they could phone me taxis. That they probably, I know that you can arrange if there's no transport, but it was never actually mentioned.
No.
You can't drive. We can facilitate taxis to and from the accommodation we've put you in, but it was never ever said, actually. I never thought about that until right now. There was no offer, so that would have been really helpful if there'd been a way of being like, maybe not from your house. I get that, that's really far away, but from the accommodation that they put you in, to have had transport back and forward, especially when you can't drive. And there's a lot of times that you do just want to show up,
Mm-hmm.
and you wake up in the middle of the night and you just want to see your baby, and then you can't do that, because the only way for me to have done that would have been with you. But actually, if I'm staying there and he's not, because he's back at work, then it's difficult.
Yeah. Yeah, that sounds really tough. Especially it's not having the access, the full access that you should have to, you want to have to your son. Yeah. Um, and do you think, obviously you just got work, Jamie, quite soon. Do you see the differences between your experiences as like the mother and the father of play?
Yeah, I'd say we had very different experiences. I was only kind of getting glimpses of what it's like being in the hospital with Clay, whereas you were there full time. Just I mean, your experience was completely different. Like I was coming in and doing sort of like a small feed and seeing him for a wee bit, and yeah, I didn't really. I think I was probably naive to how much was actually what was actually going on and how much was going on in your head. Um, no. But for me, I was only catching glimpses, small glimpses, and you were just kind of losing the will to live.
Yeah, you were catching like little glimpses, and then it was like all consuming for
Mhm.
me, in the sense of like, that was eat, sleep, breathe, being in the neonatal unit. That was it. And I think I got, oh, she's like, oh, what about me? Um, I Yeah, it was all consuming for me. Eat, sleep, breathe, neonatal unit. And then I think because I was there all the time, I got more opportunities than like,
Mm.
even for like things like skin to skin. I feel like in a way I was maybe prioritised a bit
Yeah.
more.
I was kind of when it came in, it was like, oh, like I don't know. Well, he's just resting up, and now we'll just leave it. Or Don's had him out today for about too long. Let's maybe just leave him. Some different hospitals, kind of first hospital for definite. They tried to make sure that we had as much time as possible, skin to skin, and taking him out as much as possible. But in other hospitals, they were kind of more like, no, just leave him where he is, let him rest up. So when it came to later on, at the start, certainly I was too scared to take him out. I didn't want to touch Clay at the start. I just wanted him to leave him. You wanted him out as much as possible, touching him stuff. So
And I think that came from my already understanding of the importance of that through my own work. And I think actually a lot of the times it maybe was me that was pushing you
yeah.
to have that skin to skin and have that rather than the nurses. They were quite happy if he said, oh, I don't want to be like, okay. And maybe they just didn't, whereas I was trying to express like it's really important for bonding and like all the benefits to it.
Mhm.
And you're not doing something wrong just by giving them a cuddle, it's okay. And it was probably me that pushed it sometimes a bit more than the nursing staff.
So I have to say,
Do you
you were
think sorry, do you think, Jamie, that if the staff had been pushing more for you to do things like having skin to skin and be involved in Clay's cares, that you would have felt more confident?
Yeah, definitely. Because at the start, the first hospital we went to, I just refused point blank at the start, and every single time they kept saying you need to take Clay, need to get more comfortable with like all the kind of wiring and the cords and his breathing apparatus. All of that's kind of just entangled. So being confident to take him out, I probably wouldn't have come the end of the experience if the best way to explain it is if we had done roles reverse on the hospitals we've been at. If it wasn't for the first one being so pushy, I wouldn't have been so confident. Things like even just doing his testing his NG tube and stuff like that. Like it was all because the first hospital were so pushy for me to do stuff.
Pushy in a good way.
I definitely in a good way. Yeah. It was more like you need to get comfortable with this. Like it's not a bad thing.
They were encouraging you.
Yeah. Like, because I'd say for the first 3 or 4 days, I just didn't really want to do anything or go near him, or I just wanted to look at him and stare at him, whereas they kind of kept at me to do stuff. And then I'd say that kind of made me a lot better getting towards the second and third hospital. But definitely in terms of our journey, the first hospital being the most pushy, but I got the most out of it, and that's probably where I felt most comfortable. And then as you kind of went through them, coming towards the end, they weren't as pushy. They kind of just wanted you to leave Clay as he was and stuff like that, and that's where I felt least comfortable almost, if that makes sense. So I definitely say when the nurses are pushing you towards spending time and encouraging you to do more stuff like the NG tube and the testing, the feeding, taking them out of incubators and stuff like that, that helped me massively. So I would definitely say when they did do that, it was much better. So I don't think I would have done any if it wasn't for them.
No. So I think the first hospital we were at, he was quite sick and he was very little, and then we moved to another hospital and they were really good as well and encouraging me. You weren't there as much because you were back at work by that point, but they were very like, it wasn't like let us pass you the baby. Like it wasn't like, oh, we'll pass Clay to you. It was like, no, like we'll help you get him out and we'll help you pick him up. So they taught us I remember they taught us a really good way, to get him out and how to like flog, like how to get him on us. And it was like we had a little thing over our necks and then we put the cover over here and he sat and it was like he was in a little kangaroo pouch. And they showed us a way to do it and like how to organise everything, that then when we went back to the original first hospital, when they were encouraging you to do it, you were like, I've done this before. Like we've got shown, like, so actually there was then times through the encouragement of like, and through the teaching of the other places, that then we would be sitting and you would be awake and you would be like, well, we just take him out. And instead of having to ask a nurse if we were allowed to, you would then be like, oh, I know how to position him and I know like what to do to get him all comfy and cozy. So we'll just take him out because it felt appropriate for us. Whereas then I think
there's kind of two different fields within the different hospitals, right? They're caring for the baby and you're just there as mum and dad, and then there's you're caring as mum and dad and we're there to assist you.
yeah,
And definitely when they're there to assist you care for your baby was a better approach. Like, you learn so much more, you feel more part of it, and I got much closer with Clay at that point. When you were kind of there to help you do what you need to do, and I think if the difference is if you're lucky but unlucky in a way, it depends on how you look at it. We had to have experience of various different hospitals, so we knew what we were entitled to and what we're not. So if you weren't, and if you're going to a hospital that they're caring for the baby and you're just there as mum and dad, like, it's a big thing that I would definitely say that you need to push to be able to do things yourself, and they're there to help you do what you need to do, because ultimately they're there to look after Clay, yes, but it was to get into a stage that not only is Clay fit enough to come home, but we are fit enough as parents as well to look after a baby that's not 100%. Do you know what I mean?
Yeah, so how you to be a parent.
Yeah.
yeah. And I think that was a big thing. Is like when like we went between different settings, and I think we were really encouraged and really empowered in particular settings, that then when we moved on to a setting that maybe had a bit of a different, like, that were more like, no, we can just go make up his feeds and we can just do that. You kind of like, oh my, do they even need me? And it was all like, oh well, I'm not doing anything, so I'll just sit here. And they were doing it from such a place of, we can do that because that's our jobs and we're getting paid, and like from a good place. But it kind of made me anyways feel a bit redundant, because actually when I was able to make up the feeds, I felt like I was doing something. I felt like I could help. And I was like, oh, I'm doing something for my baby, when everything else I can't really do. Like, I couldn't do all of it, but like I could go make up his feed and I could give him it. Whereas it was a big transition to then, like, it kind of felt like a step backwards at one point, where you were like, well, I've been doing all this, and then they're like, oh, don't worry about it, we've got it. And then you were like, but I actually quite like
Yeah.
that.
I feel like I know you're talking about the differences between mother and father, but definitely that's something that we definitely had in common, is that the only time I felt like I was actually doing something for Clay was the feeds,
Mm.
making up the bottles, cleaning them out, doing this and doing that. Like, all that kind of stuff makes you feel like you're doing something for your child. So
When
that's something I do agree with. I feel like if you get up and actually do stuff, it does help massively.
yeah, with your confidence and with your
Mm.
bond.
Oh, 100%.
So we've talked a bit about the differences between the units that you were on. How do you feel like that impacted your neonatal journey? Those kind of differences in how much they were using FICare, how much they were, allowing you, not allowing, it's the wrong word, but how much they were supporting you to be the parents of Clay.
I'd definitely say that. I'd say the ones that were doing the FICare stuff made it easier on your experience. The ones that weren't did make it harder. No, that they weren't. I don't want to say they're neglecting it, but the ones who weren't as focused in FICare made it a lot harder. Your experience a lot harder to kind of manage and also be a part of. Because I go back to it, like, I think that the FICare stuff definitely kind of it helps you me become a dad. It's there, and it makes it everything, all the sort of third party external issues and stuff like that. It takes a lot of that stuff away and it lets you focus on being a dad. Whereas with people that weren't, or the kind of the hospital that weren't, you definitely felt that, and it kind of then you felt redundant. You didn't feel like a dad. They then started worrying about third party stuff like it. I definitely felt you could clearly see the difference in people that were using it to people that weren't, and I felt much more comfortable in the setting than the people who were using it personally.
And I think overall in our journey, like you're saying, lucky or not lucky, I think the impact of going all of these different units was good, because we were able to see a varying examples of, like, family integrated care and how it can work and how good it is. And we were able to take that with us between each hospital that we were in, of being like, well, I've already learned this, so I know how to do it, and like kind of advocating for for that was really good. But I also think not all hospitals, because we were across different health boards, so it wasn't all just in one health board, they don't all have the same policies, or they don't all have the same training, or they don't all do things the same way. And that was really difficult when it came to family integrated care, because we, as a family, and as a unit, had got into, say, a routine of, we would make feeds up, or we would give him a bath, and then this was his routine and this is what he got, and you worked with the doctors and the team to be like, this is what's best for my baby. And then you move to different health boards and they're like, oh, well, actually we don't do that. And I think that was really difficult, because actually if you'd always been in the one health board setting, you wouldn't have that conflict in information of. And I think what I personally really struggled with was that it was just, oh, we don't do that here. Rather than, I felt that if you are going between hospitals, it would be really beneficial for them to say, well, we know that this hospital does this and we don't do that, and then give the rationale behind it, rather than just, we're going to take that thing away from you that you have been used to. And there were so many examples of it throughout units, whether it was, the main one for me was swaddle bathing, as we were allowed to swaddle bath him and then we weren't. And nothing had changed in terms of his health. It was just that the different settings done it differently, and one hadn't had the training for swaddle bathing. But instead of just having a conversation of, it's, we don't do that here because we haven't had the training yet and we're working towards it, it was like, well, we don't do that here. And you instantly think, well, who was right? Was I putting him at risk or? And the other ones were like things like prebiotics. And one hospital did do prebiotics, and then when we transferred to another one, they instantly took us off it. But I remember having a full conversation about why he was started on them. So then when they took it away, it felt really conflicting. And I don't know if there's a way for hospitals between themselves to say, well, if they start their care on this policy, then we follow that all the way through, rather than the chopping and changing, because that was quite hard.
Mm.
And it would, yeah, the lack of continuity, and then also the lack of what I felt was control of, even when I was able to say, but we had that before and why can't, it was kind of always just shut down, rather than saying like, well, let's discuss it. And actually, if mum feels really strongly on that and she's had the swaddle bathing and she's had the training for it, then is that something we could facilitate, even though we haven't done that before, or even though.
I think even transparency to tell you why you couldn't. A lot of kind of see if there's a reason or a policy in place, rather than just saying it's your policy. Well, why is that your policy? Like, what does it benefit our child doing this, or does it not? Like, I think that was the hardest thing, is us weighing up every single time there was a change. It was, have we put our child at risk before? Is that something we've done wrong by letting that hospital do that, and are we putting our child at risk by not doing it? Like, I think,
One's right.
yeah, who's right and what's right, and even just rationale behind the thinking, or rather than just being like, no, that's no policy, I'm not doing it. That was probably the hardest thing, I would say. But if I had rationale, it would definitely have helped massively.
And just a conversation of between, like an open conversation of things. And I think it could be frustrating, because something that might have we felt very strongly about was the swaddle bathing. And actually, in the grand scheme of things, sounds bad, but to them that wasn't that big an issue or that important, because it wasn't a medical thing. It was something that wasn't a necessity. But what I think is easy in that professional capacity to be like, oh, it's just a bath. But like, that was the point where we felt the most like a family.
Yeah.
And it felt like it felt like it was then a parental decision and a parental choice, the activity. Yeah, like it felt like it should have been a family decision, but it became a medical thing when it wasn't. And that was quite.
It was important to your family and to you as parents and to your bonding play. to have that moment and to do that care for him. And so if it was important to you, it should have been important to
Yeah.
him.
Exactly. And I think that's something that could have been
Mhm.
improved, is just listening. I think between the hospitals we had, like with the ward rounds, like you said, we had so many different experiences with ward rounds. Every hospital does it differently, and every hospital has different, depending on like your specialty of how like intense you are in your like care, or which part of the unit you're in. Some hospitals had like massive ward rounds that had like
Yeah, you had
like 15 people
it
and
was like 3 doctors and
and
AMPs and all sorts, and it was crazy. Like some of the ones that you went to and the setup they had, you were like you felt confident, and like
so many people.
like there was no decision that would be, we'll speak to the doctor and we'll find out, and 3 days later still waiting. The doctor was there every morning, and you asked the doctor would make the decision there and then. Whereas I felt like when you're going to other ones where there's no doctor at the ward round, it's maybe an AMP and stuff like that, and it was, we'll speak to the doctor, a day would go by, and but, oh, do you speak to the doctor? Oh, couldn't get hold of them, so another day goes by, whereas
Yeah.
the definitely, the one that was kind of set up the best for neonatal care was you could quite clearly tell, and anything, any queries you had, any issues, it was just at your fingertips. And not only that, you could actually walk out the room and the doctor would be there at all times
Like
at the
the
desk.
doctor was at the desk.
They were proper set up, and that's where I felt most at ease with Blaze Care, was having that. And that's why, going back to it, is why I said that one of the barriers was the ward rounds, because that was where I was actually present in the ward rounds and seeing that, and then not being present in the ward round, not having doctors there all times, and just kind of getting drip fed in information. It was 2 and 3 days. You can't help but think, maybe like, could that have sped up his care if we had answers sooner? Probably not, but it's something that you kind of, it plays in your head at the time. Whereas when I'm there present with all those doctors, you're like, no, 100%, they're finding the fastest solution for Blaze Care.
And I think as well, even just how they're managed in the ward rounds, is we found that like you're saying, in that situation, it was really helpful. I felt, as a family, when they would go, so what do you like? This is what we're thinking, but what do you think? And one of the times that really stuck in my mind was we were due to get transferred out of a hospital and to another one, surprisingly enough. And we were due to get transferred, and I was concerned because our first transfer, Clay was really sick, and it wasn't a good transfer. We'd had some scary complications before we'd even left with the equipment, and like he was in the incubator, he was in the transport incubator, and he was back in his normal incubator because there'd been mix-ups with equipment and he just wasn't playing ball. But it had been a really scary experience, and it was something I was extremely anxious about. And he was fine, he transferred, and then when we were due to transfer back out of that hospital, they kind of just came in that day and were like, oh, we're going to transfer you back now, like, we're happy with him. And his breathing hadn't been 100%, and partially was it my anxiety? Absolutely. But I was like, why are we transferring him if his breathing's not 100%? I don't understand. And they were like, well, he's fine to be transferred. But I was like, but his breathing's changed from yesterday. So like, what? Like, because last time it was such an awful experience. I was like, I don't want to do that again. And she was like, would you feel better if I went and got the consultant to come and check him over again? And I said, yes, absolutely. And it was no questions asked. Stepped out the door, consultant was in, and she was like, I've listened to his chest and da-da-da. And she was like, talk me through what you're worried about and let me tell you that it's fine. Rather than just be like, well, we're saying he's fine to go, so he's going. It was like to have them say, well, what do you think? And what is it you're worried about? Because actually what we were worried about wasn't always what they were worried about, but it was really helpful when they treated it just as important as the things that they were concerned about. It made you feel really heard. And like no question was silly. Whereas we did have experience in where you just were, the ward round happened in the middle of the room. They didn't even acknowledge you were there. And they would go and you would hear them talking, and you're like, I think they're talking about my baby. And you wouldn't know. And you would then be like, actually, can you come over and tell me everything you've just said? Because I don't know what the plan is. But if you missed that ward round,
You missed that.
you missed it. And then it was, well, you don't know.
Got the debrief from the nurse looking after,
Who wasn't always present on the ward round.
but certainly did, like I say, the one that was equipped for it, like,
It made
yeah,
a difference.
as soon as you arrived, it's like, hi mum, hi dad, I'm Doctor such and such, assistant doctor such and such, and they'd introduce themselves and they'd say, listen in, at any point you've got anything, just raise your hand, just talk to us, and we'll just go through it, medical terms. And then as soon as they would leave, the head doctor would then have a debrief with you and say, this is what we're thinking, this is what we're doing, this is the plan for the day, blah, 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 blah. So you knew exactly what was happening. And then, like Don said, as it kind of got further into care and we moved to different hospitals and stuff like that, you were lucky to even find out what was happening in the ward round. It would just be a word of mouth through the nurses, through notes and stuff like that. You would
Well,
find
even
out.
just not set times
Yeah.
would have been, and I know things come up and that's totally fair, but knowing that like ward round starts at this time, some hospitals were quite strict on that, and that was really good because if you were at work or if you knew it was happening, sometimes you would phone in
Yeah.
and you'd be on the phone and you could hear. But there was sometimes where there wasn't a ward round start time. It's just, oh, it'll just be whenever the doctor's here, and like we'll just, and so you're kind of just waiting, and it varies a lot. So then you weren't able to just be there, and actually it could just be so much as Clay's doing absolutely fine, so we're changing nothing, and I've just been at the toilet and I'm still sitting there all day like, where's the doctors? And they're like, oh, they've been. And I was like, well, they didn't speak to me. I had questions from 3 days ago that I've still not had a chance to say because they didn't wait. Whereas some hospitals would wait on you or say like, well, mum's actually not here at the minute, so we'll go do the other babies and then we'll come back so that mum can get that. And I think having this routine of like ward rounds at this time, so you need to, and it's finished by usually this time, would have been really helpful. But sometimes it was, and I think the main thing was we had hospitals that had neonatologists and hospitals that had pediatricians. And the hospitals that had pediatricians also had a children's ward to care for. So it was a lot less structured, which was understandable. But when you had the neonatologist that was on that ward all day, that made such a difference because there was always a point of call if you did have any questions, rather than having to feel like you were chasing someone that was somewhere else in a different hospital and you had no idea where they were.
So very much to do with communication and information sharing,
Yeah.
and making you feel comfortable that, you know, you're able to ask the questions you want to ask, that there's a process in place for you to be able to have those conversations.
Yeah.
And just a space for it, I think. Like, just to give you a space to be heard for like 5 minutes out of a day can make such a huge difference. And like could be the difference of whether I've phoned you that night bawling my eyes out or not. And a lot of the time you would be like, you just need to get to the night shift on and it'll be a changeover of staff. Actually, like it shouldn't have needed to have waited. I could, if I just had the opportunity to say something and then feel listened to, then it would have been fine.
Yeah. Yeah.
Rather than we'll wait for the night shift and try again.
Do you feel like, and I've asked this particularly, Dawn, because of your profession and your therefore previous knowledge of neonatal care, do you feel like advocacy played a really big part in Clay's journey and in your neonatal journey?
100%. Go on.
And what was that role, and what toll did that take on you, I would say, as a couple as well?
I think it was 100% such a massive part of it, and something that I felt very strongly about from the start because of my job, that I wanted to make sure that he can't say what he's thinking and feeling, but I'm checking and asking questions and like trying to make sure that I was doing the best I could for him. And I think as a parent, that also then made me feel like I was doing something, and that I was important, that I was making sure he was getting the right care at the right time, and that I was there as well, more than the nurses. Like I would start at 6, and I say start because I used to say it felt like a shift. Like you dropped me off at 6 a.m. and we wouldn't go home until 10, 11 o'clock at night, or I wouldn't go home at all when I had a room. So I was there longer than the day shift were, and I didn't leave his side. So it was really important to me that I was like, you guys are coming in for a shift and you're looking after other patients, you're getting a snapshot. Whereas I felt like as a parent, I had the bigger picture of, I knew him better than the staff did. And so it felt really important to me that if something didn't feel right, that I had to speak up on that behalf. And
I think the best example of the whole entire thing was the day coming home. Like, the machine that they hooked him onto for his oxygen was just playing up. So his sleep study was playing up something so awful, and it didn't reflect what he was actually like as a baby. Because Dawn's experience, what she had seen it all. She was there all day. She knew how she was acting. She was like, that is not a reflection of what's actually happened on the with the.
And I think, it was a huge thing of, it felt really important to me to say it so that I got it right for him. But it also was really difficult because, on the same sense, from a professional point of view, it felt like there was a lot of pressure on me to get it right. That I was like, I need to say this, because if I don't, I'll regret not bringing it up, or I'll regret not questioning it. And I would be able to look at Clay and say, he's about to have a DSAT, and I would be able to say that the machines had about a 3.5 second delay, because I could see it on him before, and I'm like, he's DSAT and I'll just need to stop that feed. And I could do it because I sat there. And one of the situations that we really had was his reflux was really bad, that was causing desaturations. And I kept saying, it's speed related, it's his reflux, it's speed related, it's his reflux. And it sometimes could feel a bit like a power struggle of the reflux. It could be something else. And
fell in deaf's ear, and it was almost, I feel like, the fact that Dawn's profession, it almost felt like sometimes it felt like the nurses and that were saying that she's overstepping the mark almost, and just leave us to do our jobs, like this is our job. And that with that DSAT one that she's talking about with the reflux, it went on for, it must have been a solid week. We were like, it's feed related, we're telling you he's reflux, and it was back and forth and back and forth and back, and eventually the doctor came
it
in
was
one morning.
only by sheer coincidence on that same situation. There wasn't always a doctor there, but it was sheer coincidence. The doctor walked in as he had
A
a
DSAT
DSAT
feeding.
whilst I was feeding him.
And he said I said, he's got reflux. Why, we know what happened? We got him in it, and we're like, no. And then quickly, instantly,
And it had been
engaged.
2 days before that I was told that, like, if we think it's reflux, we would tell you. And I was like, but I'm saying I think it's reflux. And I'm advocating that he's not happy when that something needs done. And it was well, there's a lot of things that you don't know. There's a lot of things that you don't see. There's reasons that we wouldn't start him on anti-reflux medication because he's so premature. And I was like, you're right, I don't know that. I don't know the rationale. I'm just saying it feels like he should be on something. It feels wrong to just watch this happen. And I think I kept saying it. And I don't think if it hadn't been for that doctor, I would have needed to keep saying it. But he just happened to walk in and said, is this what you've been doing the whole time? And I was like, yeah, this is what I've been saying all week, and no one has taken me up on it. This is why I think it. And he was like, oh no, absolutely, let's start. And I was like, well, wait a minute, you told me it might not be safe to start. You told me there was a reason you had it. And he was like, no, now that we've seen it. And I was like, but actually it was a shame because I had been saying it all along. And then you're like, it felt validating to hear that you were right and it made sense, but it's a shame that sometimes it needs to take that. But I think, I think it helps being able to advocate, and you feel like you've got, like, you're looking after your baby. But I think when you're advocating, it mildly, like, it's not advice to nurses, like, is like, listen, because the parents aren't trying. Like, I wasn't saying it just to try and come up with a reason for why he was out. It was because I had a genuine concern, and I was trying to look after his best interests. And, like, if a parent has a gut feeling, like, just listen to them, because I was seeing so much more of his day than any of the nursing staff could. And, like, we've got central monitoring on him all day, every day. We can see what he's doing. And I was like, no, but I'm looking at him, and I'm telling you before the monitors go off. So, like, trust me at my word if I'm feeling there's something off. And I think it's important for families to, like, trust their gut on that as well. Like, if I was to say to someone else, if their baby was in a neonatal unit, I would be like, if you think something's off, stay, because you should be listening to it. And actually, you're probably right. Like, if something's telling you something's not right, it's always worth bringing it up and just saying it. And it should, in an ideal world, always be met with, like, okay, we're going to hear you out and we'll give we'll try our best. How can we work with it? And actually, if it had been meant like that for us, it would have been such a change. Like, it would have been such a better experience.
We always say you're the parents, you are the parents, and you are the expert baby. You know,
Yeah.
it's your baby. And as you said, you were there with your baby more than anyone else was, and not looking after other babies, just focused on your baby.
And it made it difficult because when I didn't have a room and we left at night, and it says we at times were able to leave a shift and predict how it was going to be handed over to us the next morning, whether his oxygen had been increased or put down, or based on who was looking after him and how they nursed and how they cared. And but then you would get you would hear something back and you'd be like, that just doesn't make sense. And it almost made you not want to leave, because you were like, well, if I'm not here, it was particularly the sleep study. The sleep studies he was getting were showing these significant desaturations, and they were just deemed him not safe to go home because he was having these desats. And I was like, he's been having these desats now for 2 weeks, and every time he has them, no one's intervening. It always self-resolves. We've not changed anything. We're not doing anything to treat them. We are just essentially waiting for him to grow out of these. But we're getting out at a point where you're telling me he's not going to grow out because he's too big. And I refused on the full night of the sleep study to leave his side, because I was like, I need to be able to, whatever they're putting on that paper and what's coming up on this graph, I want to be able to explain what actually happened. Because is it that he was picking about and wiggling his toes? Or is it that he had a big feed and was hiccuping and was holding his breath? Like, there were so many things that then you were like, well, I need to be there. And I need to say that, because actually, eventually, on the third sleep study, they said, like, he's still not okay to go home. And I was like, he's had this for 2 weeks and you're doing nothing. And then they were like, but their argument was, well, what if it happens at home?
And still do nothing.
And then I was like, and they were like, but you wouldn't know it was happening. And I was like, but I know it's happening when I'm not even looking at the machines, because I'm looking at him. And they were like, but if it happened and if he didn't stop holding his breath or he kicked, and I was like, I would do the exact same as what you guys are going to do here. And you've given me the BLS, like the training. Like, at this point, we're doing nothing different. Like, we're just sitting. And one of the doctors was like, let me phone, because again, it was a pediatrician, let me phone the neonatal unit, like the intensive care, like the NICU, over in the specialist hospital. And they were just like, so what is it you're doing for these? Like, when that happened, is you had to put oxygen on or waft it, or and they were like, no, Mum says that nothing's been done. No one's restarting him on oxygen. He has them even when he is on oxygen. Like, and they were just like, so if you're doing nothing and that is just how he is, and he's never had this has went on for nearly 3 weeks now, what's Mum going to do differently at home? And then the neonatologist was like, actually kind of siding with Mum on this one, like, you're doing nothing, nothing's changing. But they were just like, but the graph says so. The graph says he can't. And I was like, you're just kind of like, and it was hard. And I was like, but you weren't there all night. I was there all night. This graph's been read by someone who's never laid eyes on my baby. And it was tough, but you then didn't want to leave, because you were like, I felt a lot of pressure to be like, well, I need to be there to monitor, to make sure. And I think it's a trust thing. And it goes back to that communication and transparency of when there's been a breakdown or there's not been complete transparency, it definitely put more pressure on me to feel more like nurse, which was difficult, because I then was like, well, I'll just be his nurse as well as his mum. And really trying to balance the both of them was really difficult. And it was great for the nurses to say, you just need to be Mum. But in order to do that, I was like, well, if I'm going to just be Mum, I need you guys to just be nurses. And like, if I decide he needs picked up for a cuddle because he's crying and he's upset, I don't need to be told, oh, you've cuddled him a bit too much today. I need you to do the nursey thing and being like, okay, you do that, we'll support you. But if something medical jumps in, then we'll come give you a hand.
Yeah. Do you feel like there were needs that you had things that were important to you as a family? I mean, we talked earlier about your parents and wider family and friends wanting to visit and see Clay, things that you needed to be a family that were accommodated. And if they weren't accommodated, how do you think they could have been?
I think from a visiting and wider family perspective, I think we felt most supported in like a wider family unit when there was open visiting
Mhm.
for whoever you deemed wider family. For us, that was mainly grandparents. And we were quite limited with visitors. We've just had grandparents and then one of my friends and your brother.
Mhm.
And that was it that ever came to visit us in the time that we were there through choice. But I think it was really helpful to us when that was not restricted. I think that was a need that we were like, we just that outlet of being able to be like, do you know what, actually, it would really suit me to go and have lunch with Jamie on a Saturday and know that someone was sitting beside my baby.
Mhm.
And that was great because then we would do that. But then again, it was difficult because it kind of felt like it was taken away. But then it was like, well, unless that's between the hours of 2 and 3, don't even think about it. And it became difficult when there was then more restrictions put on the visiting times to then feel like you had the same support around you.
I would even say as bad as to say that the visiting times wasn't so much even just inside next to Clay's incubator. It was as soon as you step foot in that ward, whether it's nowhere near the babies at all, as soon as that hit like 3 o'clock, you had to leave. You couldn't even go to like there's a section with the
The
cat,
family.
your family room, where you couldn't even take your family through there. It was get out of the hospital and you're like the ward, and then you'd have to go away and leave it. I think if there was a spill room of some sort, like, and to allow you, then it would be really good. Because sometimes visiting's not for them to see Clay; it was for them to take their minds off stuff as well. So having time,
Enough.
having that time in a spill room or something.
Because we were restricted to numbers by the bedside, understandably. So the number was 3, which makes sense. But that means that if there's a set of grandparents visiting, there's only one of us. So anytime your mum and dad came to visit, I didn't. It was time away from Clay for me, and usually I'll go and express. But I didn't then get any time with his mum and dad. And then by the time the visiting was over, I was maybe still expressing they didn't even get to see me, and it would have been nice to be able to have a conversation. And I think that was something that, like, if there had been a space, so in one of the hospitals, it was like up to this door was before you go through. So there's like a reception area and a little waiting space.
You could be there.
If they could have sat there after for half an hour to an hour, like fine if they're not visiting hours was only in the room with Clay, that would have been fine to have open access to a waiting area to sit with them and know that you're still in that, because you don't want to go to the canteen to have the conversation, you don't want to leave your baby, but stepping in the room next door doesn't feel as scary. And I think the first 2 hospitals kind of had that. They had like a space that was like,
Stay as long as
you can stay there. They were both open visiting, but like even if it hadn't have been,
leaving a space. And
and then when it was restricted, if there had just been a space where it was like, if you want to invite your friend round because you're living there to discuss what rubbish they'd been watching on TV and actually nothing to do with it, that would have been just for a mental headspace to have somewhere to go that wasn't restricted to a time would have been really good.
Yeah.
To spend time as like a family unit all together rather than it being broken up because you've only got an hour in that and you've got to split up because of how many people can go to bed.
Yeah, that makes sense. I guess from your experiences and from your time on different hospitals and from your understanding of FICare then and what you know now looking back, are there tips that you have for other neonatal families to help them be involved in their baby's care?
I would definitely say speak up for what you want. Definitely, if you believe something, then definitely speak up. And as long as you know there is such a thing as FICare, then ask the hospitals about it. And if you don't like the response, then probably contact your friends to see what you're entitled to. I was extremely lucky that Don knew what we're entitled to. But if in doubt at all, come to yourselves. I think definitely they should be, because just because the hospital says this is what the rules are, or that this is what it is. Doesn't mean it's necessarily say it is. It's just probably what they're being led to believe, because ultimately nurses and the doctors aren't specialists in FICare. Really, they're specialists in looking after your baby. So definitely reach out 100% and find out what you're actually entitled to. What's your rights, kind of thing. What you
And what's helpful, I think, yeah, it's really important. I would just say, just if there's something bothering you, to say, like, if there's something that is niggling away at you or something that's important to you, make sure that you let the nurses and the doctors know that it's important to you, because that should then become important to them. And I think from a family integrated care thing is like, like, if you're scared, if you're because I think especially with you, you're you're scared, like, oh well, they've not mentioned to take him out, so I'm not going to take him out. But actually, like, just be open and say, like, if I want to pick up a baby and I want to give Clay a cuddle or give your kid a cuddle and you want some skin to skin, like, don't be scared to ask for it. Just because it's not offered doesn't mean it can't be done.
Mhm.
And I think it might not. The nurses and the doctors, they come from such a good place and they're all fantastic and they've all done amazing jobs. And I think it's easy at times potentially for them to forget that they're so focused on the medical care of your baby to then see the wider picture. And it's okay for you to remind them of that and for you to say, I really appreciate, like, just because you're saying I want to do something else doesn't mean you're not grateful for what they're already doing. And it's okay for you to say, I really appreciate everything you're doing, but I just need a cuddle with my baby. Or actually, I really appreciate that you're trying to help with feeds, but that makes me feel involved. So would you mind if I'd done it? And 9 times out of 10, they're going to say absolutely, and then they should support you in it.
Yeah.
Unless there's a really big
Yeah.
medical reason.
Nothing will change unless you speak up, is the main thing. So you just kind of need to speak up.
And I suppose for families who find that difficult to speak up for multitudes of reasons, language barriers, fear, anxiety, the gratitude that they feel kind of clouding their ability to say anything. Do you have any tips for them or any words of wisdom?
I feel like and out is if you get to know the nurses. One of the big main things for us, if we felt so strong about something, we got close with a lot of the nurses, other parents. You get close to other parents in there, like, ultimately you spend more time with the nurses and the parents than you do anybody else in your life. So get close to something. If there's someone that you feel close enough to and you can trust, speak to them and guide them. Like, one of the big main things for me was things like expenses and stuff like that, which no one was ever told about that. So I kind of took it upon myself. Anybody that was coming in, I would tell them and show them how to do expenses forms and stuff like that and where to go. And, like, if you don't have someone like that in the ward, then find someone you do trust, someone that you kind of see as a friend almost, and speak to them. I think it definitely helps having someone there. And I know it's hard to speak up to just anybody, but if you try and get close to people in the ward, other patients, stuff.
Yeah, and I think if, like, the chances are that if you're feeling that way or if you're struggling to say something or you're thinking, "Oh, I wish I could just get more cuddles," there probably is someone else thinking the same thing. And, like, you're not alone on it. And I think it's, if you can't speak to the nurse that's looking after your baby, you don't feel like you've got the ability to speak at it, like, all you can do is, like, knowledge is power. And if you've got the information and you know where to access it. So I would print off leaflets of things that I would like to do, and it's helpful when those are dotted around all of the wards of, like, the importance of skin to skin. It just been like, oh, like, and just getting into, like, a kind of conversation about it, of just being like, oh, what's that? And then it opens a door to then have those conversations. And if you're thinking about it, the chances are that most of the parents and they'd have thought it at one point as well. And, like, it's really scary at the start to, like, do it and to be like, I want to do that, and I don't actually, or if you, especially you don't know. And I think if you look up what it is, like you saying, what you're entitled to, or, like, I'd love to be able to, like, feed my baby. Can I do their NG feeds? Like, if you're looking on, like, websites like Bliss, it'll tell you that you can get that training. And then if you've seen that, it's just that, oh, I saw that. Is that something you guys do here? Rather than it coming at a place of like, why can't I do this? Or let me do this. Of just like, I've seen this. This is something I'm interested in. Is that something you guys do? And probably it is.
I guess my final question, which is kind of leading on a little bit from what you just said, Jamie, about supporting other parents with um, their expense forms because you knew that they were entitled to things that they didn't know they were entitled to, is what the importance of speaking and peer support was for you during your neonatal journey.
I don't think you would have survived if you didn't. Like, Don very much, like, even to this day, there's like fake group chats, like
Yeah,
friends,
they were at our wedding.
the better guys, and like all that kind of stuff. Like, your peers are brilliant because the things that you think you're feeling is exactly what Don said. Everybody else is feeling the exact same thing. There were, I would say, 99% of people that walked into that ward or the wards who had a baby there were feeling the exact same things. And once you get to know them, you'll find out that they're feeling the exact same ways. And then it's a bond that you'll probably always have.
The people around you, the parents around you are going, use it some very unique experience.
They're the only people in the world at that time who understand fully what you're actually going through. They're the only people in the world.
I think it's easy, like I'd say if the hospital you're at has a thing on, like a pizza night, or if they have, it's easy to say, oh, sorry, no, I'm not going to go to that, just go. Because the bonds and the connections that you can make are going to make your journey so much easier.
Yeah, the second hospital we went to done a week's event of some sort. Basically, it was free something of some sort. There was
just like coffee and a biscuit.
And we at the start were always like, I ended up just going, and it's honestly the best thing you can do is just get involved, get talking to people, and any event at all. Yes, and it's going on because
even if you're not there for long, because we were quite long term, we were 12 weeks, but we are still in touch with families that babies were maybe only in for like 7 or 10 days. But that 7 or 10 days to them is just as scary as those 12 weeks were for us. And you might be thinking, oh, I'm going to be home soon. Actually, it might not be then that you want to reach out to that person. It might be in a couple of months' time when you are both having the exact same anxieties because you've taken your baby home. And you're like, oh, I've got their number. I'll just ask how they're getting on. Like, just speak to the other parents. And
that's huge. I'd say that's an absolute must. If you're going to wards and stuff like that, like it's get to know your peers and people around you and stuff like that. 20% all our parents.
That's amazing. It's really great that you had that support and that you also kind of see how valuable that's been to you throughout your journey when you were discharged as well to now.
Yeah. And I think it's really good for hospitals to know that's so important, to like for them to encourage it.
Yeah.
Because as much as it's like, well, no, you're not there for the party and you're not there to like necessarily make friends, but like how amazing if something good can come out of like such a difficult time. Like, yeah, that's not why you're there, but it's a silver lining if you're going to take something positive out of it. And I think which it was really like,
it makes your experience.
It makes your experience better, just having someone to talk to that's there. Yeah.
Is there anything else you guys want to add about how family integrated care impacted your neonatal journey, or anything else that you feel like you haven't mentioned?
I think it's just that when family integrated